Many of us will face significant health problems at some time or another in our lives. They may seem overwhelming, but there are many organizations throughout the country dedicated to helping face your particular health challenge. Being aware of those resources is necessary, and that's what this program offers you: information on where to turn for help. Have you ever started the day with achy joints, had a low-grade fever, and just felt really tired? You've probably had all those symptoms at one time or another, but for Debbie Johnson, the pain continued, and doctors couldn't find anything wrong until she was diagnosed with lupus.
When I was 17, I was diagnosed with lupus. I was very fatigued. My mom brought me into the hospital constantly trying to figure out what was wrong with me. I've got the reduced kidney function. I have a weakened immune system.
Lupus is an autoimmune disease in which the immune system, in all of its complexity, turns against itself and attacks the body's own tissues.
For a lot of people, immune disease, the juxtaposition of those two words means AIDS. And in fact, the immune system is very broadly based, and you have hyperimmune function, which is lupus, which means overactive, and you have hypoimmune function, which is AIDS, which is underactive. The two diseases are as far apart as you can get. I can give you some close relatives of lupus that are totally unrelated, but people think they're related. Chronic fatigue syndrome, Lyme disease, rheumatoid arthritis.
Even though lupus is a common condition, it's often misdiagnosed. That's because it has a tendency to mimic other illnesses.
Lupus is a chronic illness, but in the initial stages, it may be very difficult to diagnose for a couple of reasons. One thing is that the symptoms initially may be very nonspecific, sort of body aches, fatigue.
Now, this is very interesting because Linda has a typical malar rash.
One telltale symptom of lupus is a red butterfly facial rash. While the rash may help doctors diagnose lupus because it's a visible symptom, it's not always present. Internal involvement is more difficult to detect. Other symptoms of lupus include achy or swollen joints, fever over 100 degrees, prolonged or extreme fatigue, skin rashes, anemia, kidney involvement, pleurisy, sun or light sensitivity, and seizures. Lupus is more prevalent in some races, particularly African American women.
That happened overnight.
Patricia suffers from systemic lupus. While her skin involvement is easy to see, her internal tissues are also affected. Patricia was diagnosed with lupus 16 years ago. She worked as a secretary, but had to stop working when the symptoms became too disabling to continue.
It's like overnight, everything just stopped completely. I haven't worked since 1984. All my dreams of what I wanted to do, it just came to an end. And now it seems like I live from day to day.
The way we treat lupus is very simple. We suppress the immune system. That immune system which works to protect the body, we have to suppress. And we do that with potent medicines like cortisone.
Systemic lupus is very treatable. You can really control the symptoms and the damage from lupus with medication. But you can't cure it. You can't really cure this immune system problem.
The cause of lupus is unknown. The cure of lupus is unknown. It is not a terminal illness like cancer. It's not a terminal illness like AIDS. But it is an illness that's chronic, and it can be very deadly, and it kills a lot of people.
The Lupus Foundation of America supports a great deal of research at the basic level and also the clinical level.
The Lupus Foundation of America was founded by patients. They're a shoulder to lean on. For Mike, they were a source for information. Since the majority of lupus patients are female, he appreciated the support groups available through the foundation.
Back in then, when I didn't know anything about lupus, they were extremely helpful.
The thing about lupus is it's really not always a gloom and doom diagnosis. If someone hears the word lupus, they often think the worst. But in fact, many people with lupus are living with it as a hidden disability and are functioning quite well, or very productive.
I do have lupus, but it's not something that I will allow to beat me. It's not going to control my life.
I have hope that one day there'll be a cure. I still have that hope.
If you have these symptoms or suspect you may have lupus, contact your family physician or a rheumatologist. The Lupus Foundation of America is the best source of information. Through its local chapters, the foundation provides information, education, and support for people with lupus, their family, and friends. Contact them or the local chapter serving your area.